An abdominal assessment is an important part of a comprehensive physical examination to determine a patient's digestive health. This instructional video will highlight key performance elements for nurses during an abdominal assessment. The practice of proper hand hygiene is a key performance element to help reduce the spread of life-threatening infections and improve patient safety in healthcare facilities. Proper hand drying and the donning of gloves are also key performance elements of hand hygiene. They are especially important before touching a patient or beginning a clean or aseptic procedure. Begin your assessment by positioning the patient supine and explaining the procedure. An abdominal assessment has 4 steps. The first step is inspection. Begin your inspection of the patient's abdomen with the patient in a supine position. Inspect for skin integrity, uniformity, or symmetry, lesions, scars, striae, color, contour, flat, round, scaphoid, distension, herniation, aortic pulsation, respiratory movement, and on thin patients, visual peristalsis may be present. Step 2 of an abdominal assessment is auscultation. Start by warming the stethoscope in your hands and use light pressure on the stethoscope when listening for sounds. To facilitate listening, divide the abdomen into 4 quadrants. Start at the right lower quadrant and follow the direction of bowel movement until all sites are auscultated. Normal bowel sounds are high-pitched, gurgling sounds occurring approximately every 5 to 15 seconds. Auscultation should take between 5 and 35 minutes. Listen continuously for a full 5 minutes to determine the absence of bowel sounds. This is a medical emergency requiring immediate treatment. Step 3 is percussion. While percussing all 4 quadrants, listen for tones. The most common tone is tympany, a high-pitched sound caused by air in the gut. A flat sound without echoes is called dullness and is usually heard when percussing over organs. Dullness may indicate an abdominal mass. Step 4 is palpation. Palpation is used to detect masses, tenderness, organ enlargement, and ascites. Begin palpation by explaining the procedure to the patient. Ask the patient to tell you if they experience any pain or tenderness throughout this procedure. Begin with light palpation, depressing no more than 1 centimeter in depth. Continue light palpation throughout all 4 quadrants while observing the patient for facial grimacing, muscle guarding, which indicate pain and tenderness. If no pain and tenderness is reported or observed, repeat the process, this time using deep palpation, depressing 3.8 to 5 centimeters in depth. Continue through all 4 quadrants and again observing for any facial grimacing or muscle guarding which would indicate pain or tenderness. Pain and tenderness in the right lower quadrant may indicate appendicitis. In accordance with the World Health Organization guidelines for hand hygiene in healthcare, healthcare workers should perform proper hand hygiene after touching a patient and their surroundings.